Thank you, Dr. Garrett. I appreciate you talking about something that has become increasingly important to us in healthcare, and that is resilience. And we focus a lot with our grand rounds on the science in areas of infection prevention and control, and in epidemiology, laboratory sciences, pharmacy, and all of the partners. But we're all experiencing the same issues, and that is, how do we stay the course? This has been one of the largest topics of conversation in a number of areas, and I think maybe as we are getting toward the end of the year, where we're thinking about how to regroup and set up for 2023, thank you for taking us through some of the approaches for resilience. So thank you, Dr. Garrett. Can I turn it over to you?
Awesome. Thanks very much. And I appreciate the invitation to be with you. For those of you that were expecting a hardcore infectious disease topic today, sorry to disappoint, but as Dr. Carrico mentioned, I think this is a really important topic that we need to focus on. We've all experienced issues with resilience, whether on an individual level, a professional level, personal, or frankly, an organizational level. And right now, this is something that is dramatically impacting healthcare that we don't have a really good handle on. And frankly, I'm not sure we have great systems to deal with this in. So I wanted to just sort of hit on what the little sort of impacts of low resiliency are. We'll talk specifically about ways that we can drive better results, both as healthcare professionals at the bedside, as healthcare leaders, and also as healthcare organizations. And then lastly, we'll talk a little bit about the impact of chronic stress at a different and more granular level than we typically deal with. And hopefully this will give you some nice tools and tricks that you can use, whether you're a leader of people, or if you're just trying to frankly lead yourself in a new direction. So I thought it would make sense to start with resilience and what it is in general. And the way that my brain thinks about resilience is it's our ability to return to our baseline, right? So everyone's baseline is very, very different. You know, for me, I really like trauma. I like emergencies. Some people can't stand them. You know, if you were to take somebody who was used to a very controlled environment and put them, for example, into the field, into a traumatic situation, or, you know, take them out of their controlled environment and put them into an unfamiliar environment, their resilience is going to change. And so all we're trying to do is look at the individual perspective of where that person was before, and then how do we get them back to that highly functional baseline. And so again, this is going to differ by every single individual that we're trying to do, but we're just trying to get back to that baseline. Now, resilience itself is one that we actually have a ton of research on, not as much necessarily in healthcare as you would think, but a lot in the military and a lot in public safety. I started my career in public safety and actually still work part-time in EMS. And it's something that is hugely impactful. As a matter of fact, yesterday, one of my good friends and colleagues is a police officer here where I live, and he was actually shot in the head. It was an extremely traumatic situation, as you can imagine, both for him, the officers that responded, the paramedics and the fire department that responded, as well as his entire department. But believe it or not, one of the people that was hit most with resilience issues with this particular incident was the 911 dispatcher that actually took the radio call that an officer had been shot. And so when we think about those impacts, right, and apply those to healthcare, we've seen this happen every single day with the losses that we experienced during COVID. We're now seeing this with our staffing situations. And so this is something that we can learn a ton from other industries. I've called out a few here, like our emergency department colleagues. Navy SEALs are certainly a great example of highly resilient organizations. And then our public safety professionals. You know, these are individuals that are well-trained, that are expecting these types of difficult scenarios, and they're able to bounce back, right? They're able to compartmentalize. And that is something that does help for sure with resilience. Now, resilience is also a critical thinking skill, right? In the essence that it allows you to sort of adapt and overcome. That concept of agility allows us to build higher levels of resilience, right? What it's not doing is saying that you can't go through something, right? So it's not going to create this really strict boundary that is going to say, you're in this box and you have to stay in this box in order to maintain resiliency. That's not really practical, especially for what we do in healthcare. But it is really more of this mindset and critical thinking mentality that says, how do I emerge victorious from this difficult circumstance? Now, that being said, what we found is that over time, right, the body releases so much cortisol, that stress hormone is floating around, and that's going to create weaknesses and vulnerabilities within us as individuals. And so this is what COVID has unfortunately exposed, is that our resilience was already fairly fragile as a healthcare entity, but what we found was that we could not sustain it for long periods of time, right? And this is why you see in disaster management, you see people rotate in and out for this exact reason, to make sure that we maintain high levels of resiliency and frankly also safety. So the National Academy of Medicine actually did some interesting surveys, and I picked a couple of different quotes that to me just really struck home, right? And this first one is, I'm left feeling not just overworked, but incompetent in my abilities to help my patients. Now, of course, this was a quote that was collected during COVID-19. And, this was also collected from an intensivist, and we can very much understand where they're coming from, right? You start to question your ability to practice, your ability to understand evidence-based medicine, your ability to really apply what we think is what the right thing to do. Intubation, for example, was a perfect example where people thought at the very beginning of the pandemic that that was the right way to do. Let's just go ahead and throw an ET tube in everybody and be done with it. And we found that mortality and morbidity was greatly impacted on a negative fashion, right, by this practice. And so we've moved away from that and again evolved. Here's another one. It's hard to support coworkers, be flexible with constant changes, keep up with overflowing or ever-flowing new information, and still feel like things weren't getting better. This all goes back to resiliency. You've got to be able to see the light at the end of the tunnel. Now, somebody asked me the other day, they said, well, do you think staffing in healthcare will get better? Right now, my hope is yes. The reality is, I don't think that's going to improve in the very short near term. And so that is something that we have to be prepared for and really think about more of that long haul. Very similar to what we think about with long haul COVID. We have to adapt the way that we think and the way in which we practice and figure out different ways in order to be effective for our patients, but frankly, to make sure that we're safe as well. And here's the last one. I felt like I was fighting this invisible war every day, watching people die all the time, dealing with a very sick patient whose family doesn't believe that COVID is real. If you aren't in the trenches of critical care every day, you don't understand what I and my colleagues around the country have had to deal with since this pandemic started. Right? Again, from an intensive care setting, but these were individuals that had tremendous impacts to their resiliency. Right? We've seen a lot of these individuals sadly leave the profession or take non-clinical roles. And this is a reminder that it's not just the medical component to the topic, but it's also the psychological component. How do we as healthcare leaders and educators and practitioners do a better job of really going to the front lines and figuring out what they need to be ever present as leaders? Just having a leader present and visible and supportive can make tremendous differences in people's ability to actually rebound quickly. Now, there are a couple of things that we can do to impact resilience. One is to maintain the highest level of competence as possible, right? And this one is difficult because competence is going to be defined by different people, different ways. And we also know that competency is role specific. So maybe, for example, you were an infection preventionist, right? Well, infection preventionists, for the most part, don't go out and provide patient care. So the resiliency needed is going to be very different than a frontline ICU care provider that is literally taking care of patients every day. Now, are both roles absolutely important? Certainly. But the resilience that's needed and the way in which you're going to sort of rebound is going to be very different. And we've got to think specifically about how our teams handle stressful situations, right? Are there going to be things that put them over the edge? For me, it's children. I'm a big believer in providing the very best care to all, but there's something special about kids, right? I think we all sort of share that, and also our elderly too, right? Because those are sort of vulnerable ends of our continuum of care that we want to give the right care to. And specifically too, competency is going to be influenced by the type of experience that we have, and not just the number of years, but the sort of quality of the experience that we have. So just because someone has been an RN for 25 years doesn't mean that they're highly competent. It certainly means they have more experience, right, just by tenure, but that doesn't necessarily confer competency. And so we've got to always evaluate from a baseline of saying, how do we get everyone to do the same thing the same way and have standardized care? And then there's confidence. And this is one that has been eroded over time. But believe it, or sort of think about it like this: if your belief is that you are not going to be able to do anything well, let's say that you can't do that procedure or you don't believe that you can, that's going to manifest its way in your clinical practice. If you walk into a patient and say, I'm not sure I'm going to get this IV, well, I can pretty much guarantee you that you're not going to get the IV, right? The chance of your sort of mentation changing when you go in there with that attitude is really slim to none. And so our patients and our colleagues need us to believe in us first in order for us to be good, effective leaders and also good care providers, right? Because we have to be our own champions first. And then we hopefully will have our teams rallying around us in order to provide good care. And connection is another one that is sorely missing, but is so critically important in this topic, right? Now, your connection may be with your church, it may be with your gym group, it may be with your Bible study group. It doesn't matter who it is, right? Everybody's going to be slightly different, but whoever your connection group is with is who you've got to make sure you maintain it with. And for those of you in a leadership capacity that are managing people, look around your teams. See, are these individuals that you manage, are they becoming disassociated with their teams? Are they sort of stepping out of their norm? Are they starting to not want to do things socially when they did before? These are all initial warning signs that we may be approaching that sort of point of burnout. And so this really requires a good engaged leadership team that is looking out for its people. And character is another one because we know that despite the difficult times, that character is actually defined in our times of adversity, right? It's also defined in our times of simplicity. For example, if you happen to be walking through a hospital and maybe you are, I don't know, the chief nursing executive, I'm just making this up, and you see that there's trash on the floor, do you stop and pick it up? Right. And that's somebody who has immense character because they're doing it because it's the right thing to do. They're not doing it for any recognition. They're not doing it for show. They're not doing it to try to impress someone. They're doing it because they take pride in their work and they take pride in their facility. And so the same is true when we provide clinical care. We don't need someone to tell us great job. We know that we're doing a good job. And so that concept of continuous character management is going to be really helpful here. And this is where people's conscience comes in about doing the right thing for the patient and frankly, the right thing for our healthcare institutions. The power of a simple thank you goes a tremendous way. This has been something that I was raised with. My grandmother instilled this in me at a very young age. She always would tell me, she said, you don't know what someone is going through, but what you can rely upon is the power of a simple thank you. And I practice that to this day. And just walking up and telling someone, I appreciate you. I appreciate what you did. I appreciate that you stayed late. It can have marked differences in someone's resiliency just by being recognized, just by being noticed. A lot of people in healthcare right now have told me, they said, I don't feel like anyone even knows I exist anymore, right? And that's a scary place, especially with our staffing ratios the way they are, because we know when staffing is decreased and we have low resilience and we have a lot of fatigue, right, we know that errors start to creep into our systems. And so our healthcare leaders have got to be really vigilant about this in order to do that, because our health is interconnected with our ability to cope with stress, right? And our health is not just our physical health, it's our mental health, it's our emotional health, it's our spiritual health, it's our financial health, it's everything, right? It's really more of this holistic domain that, again, healthcare has not done a great job of investing in. And so now it may be that we have to think about different ways to support each other that are not just medical. They're not just the, activation, for example, of the employee assistance program, but it's general stress reduction strategies. Can we give people access, for example, to a free yoga class? Maybe that's something that's virtual. And as we look at sort of our reactions to things, we know that certain people are facially expressive. I happen to unfortunately be one of those people. For those of you that have met me in person, you know this. It is a challenge because you have to manage those emotions. When I'm sitting in a meeting and I feel like my time is being wasted and we're wasting our team's time, it's pretty much written all over my face. That's something that I've had to always be conscious of because it is right there on my face that I'm not necessarily very happy with the direction of a particular meeting, because our time is our most valuable resource that we can't recover. And so I really cherish the time that I have with people, and I try to be very respectful of other people's times. So here's another one that I think is really critical to resiliency management, which is the ability that you and you alone have the complete control over your reactions and emotions to others, right? And so it doesn't matter what someone else does to you. It does, however, matter what you do in response. And so it's not to say that you shouldn't react sometimes. Certainly there are instances where you should, but it really goes back to, are you going to let someone else cause their bad day to become your bad day? And that's really that difference between sympathy and empathy. We can understand, we can appreciate, we can relate, but we don't have to assume, right? And so this is difficult because, especially for nurses, nurses being compassionate caregivers, the most trusted profession in healthcare, it's sort of difficult to check this at the door. right? Even when you come home from work, you still have this as sort of absorbed into your system. And so you've got to go back to, how do I bounce my resiliency back up and rebalance sort of my emotional bank account? And that is that you control your reaction to the situation. There are a tremendous amount of benefits that we can actually see with good resilient systems, right? Part of those are going to be designed within our organization so that we have something at a higher level, and then those should roll down to the frontline individuals that need them, right? Part of this is from an HR perspective. You're going to see people that want to stay, they want to work there, they want to be a part of the team. You're going to see lower absenteeism because people are going to feel better and actually come to work. Sadly, we've seen an increase over the pandemic with addictive behaviors, right? Not just in healthcare, but in general. We've also seen an increase in suicide, particularly with our youth. And so resiliency is something that we need to invest in all of our personnel and stakeholders, not just us as healthcare workers. It also allows us to get back. For me, I find volunteer work to be extremely rewarding. Now, I think it has to be the right volunteer work, because it needs to be something that you enjoy doing, something that you feel compelled to do, right? Really more of that passion that you have. But I found that actually recharges me. It's weird. I may work more hours, but those volunteer hours actually put something back into me, right? And so it again rebalances my baseline. And then lastly, we found that with good resilient systems, you actually see lower mortality and morbidity. And so this is important as we look at our aging workforce. And certainly our workforce has comorbidities just like our patients. We've got to be cognizant of this to make sure that we're managing our resources effectively. There are a couple of different types of resiliency that exist. Inherent is actually what you were born with. So sort of consider this: you come out of the womb and you're sort of going to have this natural sense of resiliency, right? It's more of that fight or flight response where you put your hand on that stove, it hurts, you pull it off, right? So it's all controlled by the brain. However, what you can find is that this can be sort of impacted by some type of trauma that occurs at a young age. And so what we found psychologically is that, for example, our patients that might have been abused as a child or suffered some type of physical or psychological trauma, their inherent resiliency is negatively impacted here. There is adapted resiliency that is really something that we experience as healthcare workers quite frequently, where it's usually brought on by some type of incident. So, for example, I distinctly remember the first code I was ever in, distinctly remember. I remember the smell of the room. I remember the lighting. I remember everybody that was there. I remember the sort of sights and sounds. And I also remember the things that I was terrified of, right? And so that has sort of stuck with me this entire time. But it also allows us to be more agile and adaptable to the situations. And so as our body is exposed to stressful stimulus, it does allow us to say, how do I overcome this? And so some people are really magical at this, others not so much. If you're one of those people that's great at it, take it upon yourself to teach others, let them experience what you do differently that allows you to be more agile. It really takes, for example, a lot to throw me off. Particularly with presentations. I actually gave a presentation in Dallas last week, and they had all these issues with the AV, and then the microphone didn't work. It was sort of a complete cluster. And I remember the organization's leader said, I'm so sorry. I know if you don't want to continue, we understand. And I went up there and did a presentation for an hour with 0 slides, and I didn't use a microphone, right? I just had to talk louder. That's adaptive resilience, because I've been through that before, and there were about 150 people in a room that were expecting a presentation and were also there to get CEs, right? So the show must go on. And so we see this all the time with what we do in healthcare, is that the show must go on. How do we become more adaptive in that response? And then there's sort of learned resilience, which I think about more as this cumulative learning. And so let's say that you're exposed to a couple different things. You then start to form a memory or a muscle memory that comes from that and is activated by certain triggers. So going back to that example of a code, if you've been through ACLS or BLS training 5, 6, 7 times, you know what I'm talking about. You go back into that muscle memory of, okay, let's go ahead and start CPR. Let's go ahead and do this particular intervention. And it just comes to you naturally. We also find on the flip side that we're less prone to be able to do this if we don't practice. And so CPR is a perfect example where the American Heart Association published data that said, if we don't practice the skill, we don't use it every 90 days, we actually start to lose it. It starts to become a deficiency that we have. And so think about this in terms of the skills that you're really good at and the things that necessarily you may not be good at, because that resilience is going to change over time. And there's lots of different ways that we can individually cope. Every single person is different. I know that Dr. Carrico and I share a coping mechanism of ice cream. She's probably over there laughing right now. But when we have had a really rough day, we both enjoy some really cold ice cream. That's something I learned about her years ago, and we still to this day sort of joke about it. That is one of our mechanisms. I also really have a mechanism where I go and do things with my dog. My dog is a really important aspect to me. He's also older. He survived cancer 3 times, so there's this really intense connection there. That if I spend 30 minutes with him, it doesn't matter how bad my day was. It really changes the course of that. There's also some physiological things that we can do, like getting out and exercising and avoiding sugar and too much caffeine, for example, and certainly the bad things like going to alcohol or drugs or anything like that. One of the most effective things that we can do in healthcare is to simply take a day off, even if it's one single shift, right? The data supports that you can see marked differences in a positive fashion with our resilience and our ability to bounce back. So taking sort of that mental health day, one day away from work, or even a couple of days, a long weekend can be extremely helpful for you. And this is also something where you may do this with members of your team, right? Because you share that same level of concern. You also understand one another and you're experiencing many of the same emotions there. Now, one of the things that we're seeing more and more in healthcare is sort of this concept of clinician well-being. Some really, really large and progressive medical centers have actually created chief wellness officers, right? Now, does that have a big impact? I'm not yet convinced of that because the appointment of one person at the C-suite is not going to necessarily impact the frontline staff, right? We all know that. But if you put in place programs and support them and resource them appropriately, there can certainly be some impacts that can be felt at the front lines there for sure. And there are a lot of good evidence supporting documents out there, specifically from the Institute for Healthcare Improvement. They have a document called Improving Psychological PPE, which is all about sort of protecting the healthcare worker from some of these extrinsic forces that we don't necessarily have control over, but it allows them sort of an outlet and a vehicle in order to be successful. Now, let's be realistic though, and I'll just use an example of my favorite fast food restaurant, which happens to be Chick-fil-A, right? Even Chick-fil-A right now is suffering from staffing. The first time I went there and they said, oh, we can't open curbside. And I asked the owner, I said, why is curbside not open? And she said, well, so we don't have enough staff. And I thought, wow, this is a real big staffing crisis because now it's impacted Chick-fil-A where, they really didn't struggle too much with recruitment and retention because they were an organization that frankly, many people wanted to work for. They treat their employees well. They've got good employment practices. They're very supportive of their personnel. They give scholarships, a lot of good things. And of course, they provide good food. But now we have to adjust our expectations, not only in our sort of eating habits, right? Our Amazon packages come later. We see, delivery delays, and in healthcare, the same thing is true, right? This is a big challenge where you don't have enough nurses, you don't have enough personnel. And so the expectation that we have as healthcare providers to deliver with excellence is slightly adjusted. And frankly, the customer service expectations of our patients has changed too. Right. And so it's really an idea of trying to figure out ways to be more efficient. How do we actually practice more in a crisis mentality, but still deliver great evidence-based care and still meet our goals that we have for patient experience? One of the ways that we can do this, and this is not just related to what we've experienced over the last 3 years, but something we need to do more of in healthcare, which is I call it the stupid test, right? If something doesn't make sense, then why in the heck are we still doing it, right? We don't need to be afraid of blowing up the sacred cow. If we've got a sacred cow that does not deliver upon value, it doesn't contribute towards our goals, it doesn't help patients, and it doesn't help us, then we're completely wasting our time, right? And so we've got to figure out ways to be more efficient. There was actually an initiative that I was reading about where this was in Dallas, where they had providers that were really working very diligently to enter stuff in the electronic health record. Now, there were performance goals for the number of patients they needed to meet. And so most of these providers on their employer surveys were saying, we're working 2 and 3 hours every single night at home doing charting, right? And so they now have this new program that their CEO wrote out called Out by 5, right? And the Out by 5 was a program where they brought IT, they brought nursing, and they brought the providers together with the external EHR vendor and said, how can we simplify the charting requirements and how can we make this easier so that our providers can get out of the door by 5 and still have some work-life balance? Not only did they do that, but they exceeded that expectation, and now they're actually able to use that as a recruitment tool to providers to bring them into the system. And part of this too requires us to think differently with staffing, right? Especially with our nurses. We are still suffering a very big shortage of nursing, and we're seeing a ton of nurses leave the bedside in an individual institution and go to traveling, right? And for good reason, they're making a ton of money doing that. But we still have to think about, are there ways that we can upskill our existing employee base? Do we have LPNs, for example, that we can send to RN school? Can we use different providers differently? Are there ways for us to deploy telehealth more effectively, right? We've seen a ton of telehealth utilization over the last 3 years, and that's not going away. It also tells us that there are ways that we can safely deliver care without being physically in front of the patient. And one of the other things to consider too is the employee assistance program that we all have at our employers is really not set up for this. It's not set up to help healthcare workers actually manage their well-being. It's designed to give someone sort of a generic access to typically a counselor, not normally a psychologist. But those individuals a lot of times don't have healthcare specific training. So they're not going to understand where the client, the healthcare worker, is coming from. And so one of the things that we can absolutely do here is create more peer support groups where we actually take existing healthcare workers working in that setting, give them specific training and certification to be a peer coach and mentor. This works very, very effectively. Again, we see this in our public safety departments as well as in our military, where they have these types of individuals, and people in those different units and organizations respond really well. They like that internal infrastructure that's there. One of the other things too that I would strongly, strongly encourage you to take advantage of if you ever have the opportunity is a program called Psychological First Aid. It is by far one of the best comprehensive programs out there at not only looking at how do we serve our patients, but frankly, how do we prevent harm with us? Because that is definitely something that we have to be aware of from that perspective. This is a huge, huge thing. There's also a couple of strategies that we can use for both clinicians and leaders. This is something that, again, was pulled from the National Academies of Medicine, and they created this during COVID, right? But you'll see number one was meet those basic needs. We all talk about this in school, right? You know, what are our hierarchy of needs? How do we make sure that we're taking care of people? Again, just asking someone, are they okay? And what is it that we can do to help them? And truly meaning that can go a long way. And we've really talked about some of the other things too, but one of the most important is to have a sense of self-awareness, and also for us as leaders to have a sense of awareness around us, that situational awareness to say, hey, you know, something's going on with Dave. He's not acting his normal self. Let's go talk to him. Let's see what's going on. What can we do to support him to make sure that we've got that resource available for you? And this does start and end with leadership, just like many things that we've talked about with everything infection control related. A good engaged leader can make or break a program. And it requires an organizational level commitment, specifically from the board of directors, if you have one, to say, we're going to do things differently. We're going to actually invest in our people. We're going to create a culture of connection. And we're going to make sure that what we do in the workforce matters. And so sometimes that, again, goes back to blowing up the sacred cow and saying, we're not doing that anymore from that perspective. And then lastly, here's some strategies for healthcare leaders. Number one, just like we talked about, is value your team, right? Just communicate with them. You know, the power of just saying, I see you, I hear you, I understand is tremendous. And then coming right behind that with just constant, frequent communication that's transparent allows us to believe in the system and the people in which we work with, right? And people right now need more than ever to have something that they can believe in, that they're confident in, and that they can trust. And that's a key, I think, learning for resilience is as leaders, we have to be able to have our folks trust us, to be ever present, to be visible, to be empowering to our teams, and to make sure that we're listening continuously and acting anytime that we can, right? So wellness itself is something that is not one sort of linear pathway, but it has a lot of different modalities that can help contribute towards it. But it certainly requires us to be continuous, right? This is not a one-time investment. It requires us to think differently. If you were to ask me 4 years ago if I thought I would go get a certified resilient coach certification, I would have thought you were crazy, but I did. because I knew that this was going to be a topic area that we needed desperately in healthcare. And frankly, it contributes directly to patient safety. It contributes directly to infection prevention, and it contributes to patient outcomes and the ability to decrease cost. A highly resilient, well-functioning organism with good, reliable systems is 100% going to put out safer patient care. And so that is all built on resiliency at the system level and the individual level. And certainly we have to be completely flexible. Don't put yourself into a box. Make yourself really nimble, really agile, and have the ability to adapt and change over time. That allows us to be engaged. It allows us to learn from those scenarios, but also to provide the most best possible patient care in the most challenging of circumstances. So with that, Dr. Garrett, I'll turn it back over to you to see what questions we might have.
Thanks so much. Sorry, it took me a minute to find my mute button. So, thanks very much. I appreciated that. I think a lot of the points that you addressed are really important, not only for caregivers at the bedside, but we've seen such a big turnover in those working in public health and infection prevention positions specifically. So I certainly can relate to not only a lot of the examples that you gave, but some of the tools that you gave, that you showed us. So I don't know if we have individuals. I see people are saying great, they love the information. Any comments or experiences that people have had that would be helpful for us to learn about? Or I know, Dr. Ramirez, you generally have some questions and comments as well.
Do you have any comments in the chat?
Just a lot. Thanks for the information. So I think this is something that's really resonating with someone.
Then I'm listening to your presentation, Hudson, and it's almost like sometimes if we again, this is a very important topic, but if we assume that the resilient, we need to adapt to this difficult situation, and we need to go back to our normal state of physical health, mental health. You give advice for us as managers, that you say, okay, as managers, you need to be sure that the employees don't have a difficult situation. Don't make it difficult. And then you give advice as a manager. And then we are also have our own, but as employees, then sometimes you just need to adapt to a difficult situation. As happened with COVID-19, patients died. There was nobody fault, and the situation is critical. Then, if you cannot change the situation, the difficult situation is there. You cannot change it. And I have to go through this. What will be what would be the role of mindfulness in us to adapt to a difficult situation? And I mention this because resilience and mindfulness go together in a lot of organizations now. And how you see the role of mindfulness because of course the situation, the ideal thing is that it's a difficult situation. Well, let's change the situation. It's no longer difficult. Then everybody's happy. We hire more nurses, then we divide the work. But let's say that you're in a situation that you cannot change it. We have the next pandemic that is going to happen, and we are going to go through the same. What would be for us in healthcare to be better prepared, and what would be the role of mindfulness in all this?
So I think you nailed it with mindfulness, and we have to be realistic, right? Healthcare workers, and I'm just going to pick on nurses for a second, are not very good at mindfulness. We always put the needs of our patients first, and I think that is a challenge. And I think providers are very much in the same arena as well, because we sort of absorb that. And what we have to think about in terms of mindfulness is to do it not only alone, but also in groups. And so there is so much power in team management. You may have one person on the team. Ruth and I, for example, have a good colleague, Cindy, that is exceptional at mindfulness. She has taught me so much at this. She is really vigilant about her sleep hygiene. She's great about her eating. She's great about her exercise. You know, you have to protect those types of things. And I'll just give you an example. I am admittedly terrible at this. You know, it is one of the things where I have struggled with that my entire career because I want every single patient to have an exceptional experience. But that's not the reality that I face. I can't control everything. I can't control that the lab is slow or that we don't have environmental services available or whatever it may be. So what I've had to say is that I can control what I can control. Everything outside of that I can't control, but I will still give every single patient my very best. But for me to give my very best, I have to be at my best. And I think that that's something that we've all got to be really vigilant about, to say, am I in the right mental mindset to provide that level of care? And sometimes you have to just simply step away and say, I can't do this. And that's hard right now in healthcare because people want to say yes, they want to help. But in some circumstances, we have to say, I can't do that right now. Maybe you can do it tomorrow or the next day, or maybe you can't do it at all. You know, I think that that's something that we could learn. And as healthcare leaders, right, providing access to mindfulness programs is something that is really helpful. You know, there's several different apps that are out there that I really like that I've used. You know, I'm not a big meditation person. Frankly, it puts me to sleep in about 30 seconds. So I don't meditate well, I fall asleep quickly. Others are really good at that, but I found that a musical type meditation, something that's centered around music that I enjoy or something like that, is helpful. There's another app out there, and I'll try to get Dave the link to it, that is, it's a motivational thing. And so every day you get a new quote and there's a video from somebody that's pretty well known about how they overcame a difficult circumstance. And I found that that was really powerful. I actually watch it every single night without delay. But I think one of the most important things that healthcare workers can do is to put protected time on their calendar to do certain things. I know, for example, Dr. Carrico religiously does Pilates. You know, there's no disturbing her during that time. That was not something that she did 4 years ago. Now I know I cannot call her at certain times because she will be at Pilates and she will not answer my call. Now, will she call me back afterwards? Yes. But having that protective mechanism over her own mindfulness is something that we've all got to do.
Yes. It's working for Ruth because she's doing Pilates from 8 o'clock in the morning until 4 p.m.
Quit saying that.
She
I
works
know.
from 4 to 4:30.
No comment, no comment, no comment. But I mean, I have to say, I'm proud of her for doing that because, again, that was not something, you know, not to pick on old Dr. Carrico here, but, you know, she's somebody who gives everything she has to others without hesitation. And I think it's very powerful to see the example that she sets with saying, I also have to do something for me. And that happens to be Pilates for her. We all have to have that. You know, I've now started treating, you know, time at the gym, which I hate going to the gym by myself, but I treat it like a calendar invitation with an appointment with myself, because if I don't honor it, then I could have a, you know, a potential problem.
I think that this has been a very good overview of the concept that you mentioned, that to be our best with the patients, first we need to be our best with ourselves. And when we are, you mentioned your presentation that we need to adapt to difficult situations. And now we are learning that to adapt, you have to control your thought process or your mind. And the problem is that in medicine, the brain is the last frontier. We still don't understand how the brains work, then we are asking healthcare workers, control your brain, but we don't know how the brain works. We don't know and this is why we're gasping for these areas of mindfulness, meditation, trying to come up with something different. But definitely, probably, as you alluded, to be resilient, we have to be creative. One thing is for sure, we cannot keep doing the same. I believe that we're going to have a different result because COVID teaches us that we are not ready. When the difficulty is there and you cannot control the situation, a lot of us decided that the only answer was have to leave the profession. This is why I say that these type of interactions are important for all of us to even stop in the middle of the day and think, how do we need to, what is the way to be resilient in our work? Do you have any other comments, Ruth?
I don't think so. I think this was very good. Thank you so much. I appreciate it.
Sure. And I put the app, the name of the app is Pep Talk. I just looked it up on my phone, so I dropped it in the chat. I think it's like $4.99 or something ridiculous like that. But it's a really powerful tool that you can download on your phone. You can sort of customize it based on your needs as well. So if you're interested in that, feel free to download it and check it out.
Very good. Thank you.
Thank you
Great,
very much.
Good. Thank you so much. Right. We'll see you back then next week, next Wednesday.